We're glad you're with us today. It's a growing trend. Many people who are trying to quit smoking are now turning to the use of electronic cigarettes. We're joined today by Dr. Hahn, professor in the UK College of Nursing and director of the Kentucky Center for Smoke-Free Policy. Dr. Hahn, thank you very much for coming in.
Thank you.
Okay, how do these cigarettes work, the electronic cigarettes, and do they work well in this area?
Actually, the FDA does not approve electronic cigarettes as a way to quit smoking. The industry and advocates supporting e-cigarettes would like you to think so, and you do hear people claim that they have success. The bottom line is, though, that an electronic cigarette is really not a quit aid. It's not a safe alternative to cigarettes, and we recommend that people use a combination of behavioral support and medications that are approved by the FDA to help them quit. The bottom line is, though, they really need to talk to a provider about help, because it's a very difficult addiction to quit.
Well, why do you think people are turning to these? Do you think they're looking at it and thinking it might be a quicker fix instead of, really having to work at it?
Well, there's a lot of myth and misperception and confusion about the product because we've had this dramatic increase in advertising and marketing of the product. The FDA decided after a court case that the e-cigarettes would be regulated as a tobacco product and not as a quit aid. So the industry is not allowed to make therapeutic claims, but yet people are confused. They're using social media and other ways of advertising the product, and so people are confused about it. It is not a safe alternative. The cartridge and the vapor actually have a lot of very toxic chemicals as well as high levels of nicotine in them.
Okay, it sounds like if people were thinking of this, the answer is no. I know the UK has put a lot of research into this area. Where should people get started? If they want to quit, what do they need to do? What's the first step?
There's a lot known about what's effective in quitting. I would definitely call UK Healthcare. We have a certified tobacco treatment specialist, Audrey Darville, who is very knowledgeable and can help you quit. The health department has programs. Certainly, you can get online at www.smokefree.gov. There are lots of opportunities, and ask your provider, because a lot of healthcare providers in Kentucky know what to tell you. So don't do it alone.
Now, certainly easier if you have some support, right?
Absolutely, yes.
Well, thank you very much. We
Thanks.
appreciate that information.
Thank you.